Wow, we are seeing lots of growth around the Denver metro area. Some rural areas in Colorado, they have the opposite problem. It's getting harder for people living in those areas to get air medical services when there's an emergency. So the Now's Connor Wist is looking into this for us. Why is this happening, Connor?
Teresa, advocates say two pieces need to step up and come together and make the landing in order for this system to work. The Medicare reimbursements need to be readjusted and reevaluated, and private insurers need to help cover that cost. As more rural hospitals are closing their doors in Colorado and around the country, Air Medical Services are working on keeping theirs open to patients.
Air medical providers are filling the gap, making sure that patients can get to the closest available and appropriate healthcare facility quickly.
That's the mission behind the Save Our Air Medical Resources campaign, also known as SOAR.
You never think about being transported by air until you need it.
85 million Americans live more than an hour away from a level 1 or 2 trauma center. As rural hospitals close, it will take longer for emergency crews to get there. About 90% of people transported by Air Medical Services are suffering from a traumatic or medical emergency. But the funding to pay for that care is up in the air.
Medicare and Medicaid vastly under-reimburse for the cost of the service.
With this lack of reimbursement, patients are stuck with footing an expensive bill and at times with less support from insurance providers.
We never want to see a patient reconsidering being flown when they should be flown because they're worried about the bill. We want to take patients out of the middle.
Right now, Congress is considering legislation that would tackle these issues. One piece would require insurance providers to submit their cost data. Another would address the Medicare reimbursement rate to base on the cost of care.
If you can't rely on emergency transport when you need it, when you're in crisis, what else is insurance for? It's there to pay for these types of services.
Another piece of legislation in Congress that's been proposed would limit the ability for Air Medical Services to be able to transport across state borders. And Teresa, this would impact the 30% of transports that already transport across state borders right now.
I mean, this is a matter of life and death, Connor. Very important. Thank you so much for that.